It's my feel-good breakfast show.
Hey, what's happening? I'm Zanzi. Welcome back. Your Feel Good Breakfast Show. And I think you kind of get the gist of what Tuesday's all about, giving you education that you need, and especially ahead of today, an important day. It's World Hepatitis Day. It's approaching, and I think it's vital to spotlight this silent killer that causes over 1.3 million deaths annually. This is more than malaria, TB, or HIV in Africa. So this is a lot bigger than we think. And in South Africa alone, more than 6,000 new infections occur daily, and around 600,000 people live with hepatitis C. So with approximately 2,000 deaths each year from viral hepatitis, it's clear that we need to pay attention, but yet awareness remains low, and fewer than 1 in 10 in Africa receive the actual proper care that they need. So with hepatitis often asymptomatic until serious liver disease or cancer develops, early detection and prevention is clearly key. So we got to bring in a superstar, and someone part of the family that can join us is Dr. Chanel Martinezson, who's going to be all the way from Inno Health Medical Centers to unpack how we can protect ourselves and our loved ones, and especially ahead of something that we need to find out more about. So firstly, Doc, how are we doing this morning?
Good, thank you. How are you?
I'm fantastic. You're looking amazing and ready to educate the nation. So let's start at the very beginning, right? Like, what exactly is hepatitis, and why is it called this silent killer?
So in the name, hepa refers to liver. Okay, so your liver.
Okay.
Itis usually refers to some type of inflammation. So it is inflammation of the liver. There are different causes for it. We're probably mostly focusing on viral hepatitis today because that is the most common type.
Okay.
But it's called a silent disease or silent killer because it can actually cause significant liver damage before it even shows any symptoms.
Oh, so you don't know until you know, and when you know,
it's the end.
Ooh, okay,
Yeah.
I got you. And obviously with this being something that affects, we talk about nearly 5% of South Africans, how is this spreading? How are so many people being, would you call it infected or affected by it?
Yeah, so with viral hepatitis, there are 5 different types. So hepatitis A, B, C, D, and E.
I'm glad they made that simple for us to
yeah,
understand,
so we don't have to remember funny names. But B specifically is actually one of the most commonly spread ones, and that's spread via sexual contact, so being sexually active with somebody who is positive. Blood products can share or transmit the disease, and then from mother to child. So mothers who are actually positive can actually affect their kids
wow.
at the same time. Other types are like the fecal oral routes, like hepatitis A and E would be from infected food and things like that, but E is the most common one.
But that makes sense because if you don't even know that you're affected by it, it's so easy to then transmit it. So obviously education is key, early detection, even more vital.
Definitely.
But this is something that is affecting South Africans, across the nation, right? With regards to the vaccination program and something called the Hep B3 infant dose, how effective is this in sort of managing this and treating the symptom, and what are some of the issues or gaps that still remain in this process of solving the problem?
So Hep B3 refers to the hepatitis B vaccine, and it's given in 3 doses. So in infants from birth, the second dose will be 6 weeks, and the third dose will be around 6 months. If given on proper scheduling, perfectly, fully scheduled, if moms actually take their babies to be covered or vaccinated, there's a 95% efficacy rate. So it's actually quite effective if moms are actually taking their kids. So obviously moms need to know why they need to be taking their kids, and then taking them. And then also when moms are pregnant, they actually get tested for hepatitis B. So then they would also know if they've ever been infected by it or if they could transmit it to the children.
Is that something that's mandatory?
It's part of the antenatal bloods, but not everybody's going for the antenatal bloods. But it should be tested.
Okay. Well, if you're out there and you haven't been in this process, then hey, hang on, this is a red flag.
Yes.
So before we get into the second part of this conversation, because I'm glad that we have you here for longer, there's a lot that we need to unpack. Maybe we can just usher in this whole concept of like, how do we even know that we have it? Are there signs, symptoms that we might be at risk to it, just in case we've alarmed people at home and they're like, hey, hang on, I don't actually know.
I have hepatitis B.
Yeah, what should I be looking out for?
Yeah. The problem is that it's so silent, so the symptoms, you'll be asymptomatic, you won't know. But when you do notice things like pale stool, dark urine, jaundice, which is called like yellowness in the eyes or the
Yes.
skin. When you notice, right, so your liver sits on the right upper side of your abdomen. So when there's pain over there, and then there are some non-specific symptoms like nausea, vomiting, loss of appetite, fever. So just look out for those types of things and
Sure.
speak to your doctor.
All right, Paul, I think the most important thing is to pay attention to your body as well. So maybe have that conversation, open up that dialogue,
Yes.
and pay attention to what's really going on. Your body's clearly communicating, and hopefully you are listening. But we're going to keep listening right now because there's something we're going to plug you in terms of filling up your pocket with the good stuff. And then this conversation carries on and assists you in the best way possible.
It's my feel-good breakfast show.
Hey, I'm Zanzi, welcome back. Your Feel Good Breakfast Show. And if you were around earlier, things got incredible in terms of a conversation, in terms of highlighting what's so important ahead of World Hepatitis Day. So we're back with Doc Chanel, and she's here to explore and help us explore the practical steps that South Africans can take, and everything from screening to treatment to staying ahead of hepatitis. And I think now's the time to get informed and take action, especially since I've been very alarmed by what we discovered earlier. The silent killer, it's not showing symptoms, and almost when you realize it might be too late. But I think this is where this conversation comes into play, because we want to look at the treatments, what's available to the public out there, and with regards to private public health, are there different options? Can we access different things that are maybe more efficient in the process? What's going on in this world, Doc?
So the public sector is very overburdened
Yeah.
by lots of patients
I mean,
passing
the
away.
numbers speak for themselves,
Yes.
yeah.
I personally worked in the public sector, and I had a patient pass away with hepatitis B.
whoa.
Young boy, like 16 years old.
Is that the potential result of this? Death?
Could be.
Okay,
yeah,
wow,
yeah,
wow.
It can, because you get, so these mild symptoms, and then you get the liver cirrhosis, the fibrotic changes, liver failure, liver cancer, and then...
Yeah, okay, no, this is, yeah.
So it can progress to that. So that's why it is important that patients actually understand what's happening in their bodies and listen to their bodies. But in the public sector, yes, it's a little bit more difficult to just do a test and just go to them and say, can you please test me for
Yeah.
hepatitis? Because it's so overburdened. Whereas in the private sector, where I am, so at Inner Health, we actually try to shift patients from reactive healthcare to preventative healthcare.
Love that.
So we're actually trying to make patients think, hold on, let me just maybe just go and check. I'm not showing any symptoms, but let me just do a blood test. So at our practices, we actually draw blood. So if a practice does draw blood drawing, patients can easily get their tests done.
Okay.
They obviously have to pay for it. It's obviously a bit more expensive
Yeah.
to test because you do Hep B, surface antigen, antibodies. So it's actually a little bit more expensive, but I think that it would be recommended.
But again, this is almost like an investment into yourself, because this might highlight a plethora of issues that you are not aware of.
Not aware.
And everything I've learned from all your conversations is that early detection is pretty much key
Yes.
with regards to anything we're dealing with, because it allows us to actually take action.
Yes, yes.
Take action, how do we do that? Can we make lifestyle changes? Can we put precautions in place? I know we always had these rumors, and moms would always say, like, listen, be careful when you're getting tattoos and needles, people using syringes, I know using it for various medical reasons as well. Is this the case with hepatitis? Do we need to be precautious in these areas?
Yeah, so especially hepatitis B and C, which are the most common and the most transmittable. So that is transmitted via blood products.
Okay.
So definitely avoid using somebody else's needle, using somebody else's razor, like shavers. Those things, definitely avoid using someone else's, and always try and use a clean one
Yeah.
on yourself. So, because it can be transmitted. You might not even know that, because
So,
the
like-
person, you don't even know if they're hepatitis B.
And even something, let me just ask this, like a lot of my gents, bro, we're getting like those super faders, no blader, like a tight fade on the side. The
I'm
blade?
hoping the blades are clean.
Probably want to make sure that that's clean as well.
New blades, yeah.
I know, boys, hey, check your barber, eh? Just make sure, make sure. So we're talking about a couple things with regards to the range of different types of hepatitis, but there's also chronic hepatitis. Is it something that can be cured or managed, or is it just like, listen, unlucky, you got to deal with it?
Yeah. Hepatitis A and E usually become only acute. So acute means like it's just a few days, 2 weeks. Chronic is when it's after 6 months. So with B and C, yes, they can become chronic after 6 months. And then there are some antivirals that we can treat with. No, it depends how far along in the disease you are to say curable, but there is definitely treatment out there, and there are antivirals, thankfully, that we can use.
Okay, and I think for anybody that might be alarmed now and actually takes your advice and goes through the process of
Checking.
doing the blood, doing the tests, it comes through positive? That's quite a difficult thing to process, to have to acknowledge. But what do you do from here? What would your best advice be?
So definitely we'll explain it to the patient. So we'll educate them. That's always the bottom line of everything. But then sometimes the treatment just needs rest and rehydration and IV fluids and just some bed rest. So sometimes patients need to get admitted to hospital, and that's when we would refer them to hospital or discuss with a specialist to actually have them admitted. With my patient, preparing for this, I kept thinking about him because he actually passed away on my call. But literally resting and IV fluids and the antivirals that we can use. So supportive treatment. Later in the disease, you can get like pruritus, which is called like itchiness. So we'll treat the symptoms. So we'll treat the pain, we'll treat the itchiness, we'll treat, all the things around the symptoms for the patient, yeah.
Yo, Doc, I had no idea this was as deep as it was, but thank you so much. That was absolutely incredible. And I think if you are wanting more information, Mzansi, definitely go get it. And you can get it at InnoHealth. They have an incredible team that's just there to offer you anything. We're talking about insights, testing, prevention, treatment, everything you need. You've got options. And hey, speaking of options, we placed an option to you, Mzansi, and that was with regards to what our girl Carissa was going to wear. And even the doc came through with the theme of the green. And that's what Carissa was trying to figure out. She had 2 green looks to choose through. It was a relaxed or contemporary. But before we even reveal how she's doing, let's see what the people had to say. Mzansi came through. Teresa Micah always coming through with the quotes. And she says, "Good morning, my beloved Feel Good Expresso fam. Option 2 will look absolutely stunning on our gorgeous fashion girly Carissa." I don't know if those are question marks or not. I think that's just a hashtag style by Woolies, yeah. And I absolutely love that, Teresa. Thank you so much. Next up, we got Natasha Levendal, who says, "I love the outfit. Number 2 is really great. The combination of the green and white striped poplin shirt with denim jacket and wide leg jeans is perfect for a casual day out. And the sneakers, they add a nice sporty touch. I really love the overall look." Hey, and it comes on thick and fast with more comments. We got Boychelo Modiko, who says, "Good morning, my favorites. Hashtag Expresso." Well done there. And family option number 2 for me, it's obviously a winner. And she says Carissa Cupido is going to look amazing. So hashtags coming through there all the way. And she's saying, "Have a great day, my favorite Expresso show family." Oh, thank you. Ismail Henry also says, "Good morning. Both look good, but option 2 for Carissa today, just stunning. Stunning is the word. Then I absolutely love it." So I think, Mzansi, you have come through. I've got to say thank you so much for the votes. I think we need to now check in on how good Carissa's actually looking. Chris,